Welcome back, and of course, it's my amazing colleague, Ryan Frayson. Ryan, when we're doing product development, it's just amazing how the nutraceuticals are coming together. We're also going to be having more labs on. I want to have somebody on from Dunwoody Labs. We'll also have more people from Genova Metametrics. I also talked to Great Plains Laboratory, Dr. William Shaw. He's been busy this summer, but I'm going to get him on the program. I want people to realize that if they send me a wellness and medical history, and I'm going to put together a kind of a framework kind of form that'll include, and I don't like to call this alternative or holistic medicine. Those terms make me want to vomit. And the reason is because this is molecular functional medicine. In fact, to me, if doctors, health providers, professional trainers are not trained in this, they aren't. They don't know what they're doing. If you have someone that's getting muscular cramps, and they don't talk about the fact they may have low magnesium and may need not only topical magnesium, like our magnesium oil, like Magna Charge, but oral magnesium glycinate malate, which not only goes to the mitochondria, but 300 other enzymes. The health provider doesn't know what they're talking about. And if they measure serum magnesiums and don't measure intracellular, they also don't know what they're talking about. So we're there to kind of challenge them and challenge their patients to take their doctors and their health providers and their professional trainers by the lapels, nicely, but aggressively, and challenge them to say, do you really know what you know? Because I wake up every morning realizing how ignorant I am and how much I want to learn more, like Leonardo, which I consider one of the kind of minds that's kind of raced like mine, always trying to learn more right to the moment of his death. And he was quite an old man. I think he was in his late 80s. And the same thing where we had, I was watching last night the story about Archimedes. And, of course, Archimedes was cut down by a Roman soldier because he would refuse to stop working. And he was, again, in his 80s. I think what we have to understand is we don't have an approach toward learning and an approach to realizing how ignorant we are. We really aren't going to advance to anything. And, of course, medicine really is a choice of, can you move your butt and exercise, like vibrational exercise? Can you do the detoxification things like hyperbaric oxygen, which I do before my show? Can you detox your body with nutraceuticals like green tea select and xenoestrogen detox and NutriDefense? Or do you want to take a dozen or so toxic drugs and become slovenly and eventually develop multi-system diseases that will dispatch you after you become drooling and demented? I mean, that's your choice. Not a very good choice. And the numbskull doctors really don't care. They're like the vultures. They should put white coats on vultures, and you can hear like as the bodies are lining up going to the hospitals on the ramps because they can't walk upstairs. And the doctors are just like vultures, just waiting. But you won't exercise, you won't detoxify, you won't change the toxic food. In fact, I've got a whole long list, laundry list, that American food is probably at the bottom of the list, it says, and this is published articles, for food safety. Well, if you don't eat clean, non-toxic chicken, you're going to get arsenic in your body. And I see it over and over again on the QRMA tests and on blood testing, stool testing, etc., and challenge tests. And then when we look at people's ability to digest food, one of the first things we see, and this is also, we see it in teenagers and young people. I had an 11-year-old, 11. The QRMA test was sent to me. This 11-year-old has low digestive enzymes and low hydrochloric acid. 11. I mean, and then you look at their nutritional deficiencies. It's like, what is this kid eating? He's got to be eating garbage all the time because there's no way that this child's going to be healthy. And if he's not unhealthy at 11, what's he going to be like when he's 20 or 25? Not good. Right. So our food supply in America is crap, to be honest with you. It's soothed by a large food industry that's completely corrupt with the corrupt politicians. There's virtually no oversight. We have a so-called honor system, they call it, which I think is sickening, for health, food safety for things like salmonella and so on. And we wonder why, when we put genetically modified food in the feed for cattle and we have cattle-fed pro-inflammatory feed, why people get arthritis and become demented and get heart disease when we know only oxidized cholesterol, including in the animal, will get under your artery walls. Only. And we know this is a fact. So when numbskull doctors out there say, I wonder how somebody got a high blockage near their such and such valve of their coronary artery when their cholesterol is, quote, normal, because 45% of the people with blocked arteries have normal cholesterol, but they don't tell you how much of it's oxidized because the doctors don't know and don't give a damn. As they say, they don't give a rat's behind. And if you challenge them the typical response is the doctors will look sideways over their glasses and say, "You're highly informed, aren't you?" That's what I literally had a doctor say to me. "You're highly informed." I said, "Yeah, do you want to know more?" No, they don't, because they can't deal with the guilt. Guess what? I have my triple dosage of Pia genes fully operational. Pain in the derriere, let's put it that way. So let's talk about digestives. People don't realize how many people out there don't even digest their food. It's a lot, and you don't necessarily have to be in your 80s. You could be in your teens. You can be in your 20s. You can have a horrible gut dysbiosis, and we wonder why. Why the heck are people just not getting better? Well, they're not digesting their food is a good start, and they got gut overgrowth, the bacteria in their small bowel. They've got leaky gut, so they got food allergies that are crashing on their brain, their liver, and their cytokine levels are high, so their muscles are cramping, and they're leaking out magnesium because they're under stress. It's an endless nightmare of a cacophony of bad food, no proper exercise, and the toxins exposed in everything people eat, including aspartame, Splenda, and everything else that the fatal drugs allowed idiots will provide. So let's start off with digestives, and we'll continue down the line here, Ryan.
Sure.
Why do we make digestives for stomach acid? How come everybody else is giving proton pump inhibitors like... Yeah.
Most people's common reaction is, generally I've heard I have too much acid, or my digestive problems occur because I'm producing so much acid. And that's really an abnormal situation. What's typically happening is people produce too little acid. Why? Because when the body's under stress, or let's say you eat on the run, which I know everybody out there just nodded their head that they like to eat, not like, but most eat their food on the run. When you're doing something like that, the body can't utilize and produce enough acid like it should because it's too busy hustling around doing other things that you want the body to do at the right time. That's why it's important to stop, think about what you're about to do, which is consume food, sit in a quiet place where you can relax a little bit and let your body get ready because it needs to produce the acid, which is a very intense thing for it to do. So what happens is we end up people with long-term chronic low acid levels. Sometimes they get to the point where they produce no acid, and they end up with just all kinds of chronic digestive disorders, including gastroesophageal reflux and things like that. And so by using digestives, what you're doing is you're supplementing the body with additional forms of both betaine and glutamic acids, which are hydrochloric acids that allow you to break down your food properly. It's also enhanced with gentian root and pepsin for breaking down protein and to stimulate basically the body's ability to produce its own acid again. And so by doing this, you then are able to break down the food properly and send the right bolus with the right acidity or pH into the small intestine. Because if you like to use things that are acid suppressors, what you don't realize is you're sending the food bolus that's been breaking down into the small intestine. It's at the totally wrong pH level. And if it's not at the right pH level, what then happens is you change the pH that's going on in the small intestine, and you end up getting what's known as SIBO, or small intestinal bowel overgrowth, which is becoming a very chronic and well-understood problem. And the fact that it hasn't linked back to so many of these acid inhibitors is fairly shocking.
I found another interesting link as well. It's linked to leaky gut syndrome, which allows large protein molecules that are in your food to leak across the gut wall, which then can cause what's called homologous immunological attack against your cell tissues. So if a protein in something you eat looks like something, or a stealth pathogen, looks like a protein on the surface of an organ in your body, like your kidney or your liver, your body's immune system is going to get confused and it'll attack it. It also is going to increase levels of cytokines throughout the body, so it's going to break down the blood-brain barrier. It's going to increase joint inflammation. It's going to put the higher level of stress on all the organs in the body, and it'll start to what we call a overall stress reaction, because elevated blood insulin resistance, elevated leptin resistance is a stress reaction to maldigestion. And one of the long-term effects, of course, is stomach atrophy, so you lose the ability to have intrinsic factor to absorb vitamin B12. So by the time you get about 65 years of age, 2/3 of the population are abysmally low, and the rest of them are moderately low in B12. That's just one of the metabolic pathways, methylation. It's not good. and wonder why people get old. They get old because they don't take care of the body. So we got Digestes. It's, if you want to call it, its pair is Gastrozyme, which is the most powerful, broadest spectrum digestive enzyme. It even has a glutenase. And it also has a lactase, but we have the lactose blocker that's the only neutral pH lactose enzyme. And milk product it's in everything. And, of course, a lot of people don't realize that even relatively small amounts of milk lactose will cause problems in some people. The lactose blocker will stop that. So it could be in breads. It could be in all kinds of different foods and packaged foods. And also just in the small bowel. You see, if you're having yogurt and you say, I want my ice cream, I want my yogurt, but I don't want cramps or diarrhea or irritable bowel syndrome or food allergy reactions causing all kinds of havoc. So let's talk about these for a minute. Gastrozyme and lactose blocker. These are amazing. Well, right, we might talk about the carbo blocker, too.
Yeah, let's look at, first, to help people better identify, like, which formulation might be a good step for them. Obviously, you can help with that, Dr. Bill, but if symptoms occur usually when you eat foods within an hour, hour and a half of eating, sort of like you're feeling a brick in the stomach, something's not right, kind of feeling that reflux type issue going on, then more likely that Digestes that we were just discussing before the break is going to be appropriate to make sure that you're breaking down your food properly, have enough acid and so forth to do that. But symptoms that occur an hour and a half or so after eating food usually starts giving the telltale signs that you're looking at an enzymatic deficiency. And so that's where Gastrozyme, the 100% vegetarian, ultra-powerful formulation that really breaks down all different food components in the body, and including the ingredient dipeptidyl peptase 4, which is the gluten breakdown enzyme. The formulation is really powerful for being able to support, like we talked about, that bolus that's coming in the small intestine, and making sure that it's able to break down the food all the way to those dipeptide formats for absorption without triggering the immune reaction. That's a big problem with foods. Even the healthy ones, if our bodies don't break them down properly, they basically create inflammation. And so by using these proper formulations at the right time, you end up getting the food broken down properly, you start retraining your body, and eventually, you kind of regroup the way that your digestive system is working again, and works wonderful long term. You brought up a couple new ones. Let's go with the carbo blocker formulation. That's a very, very unique ingredient that we're looking at here. That is basically two forms of enzymes that basically inhibit a breakdown for sugar and carbohydrate that's driving up our blood sugar levels very quickly. So even though you're going to eat something that has a carbohydrate load to it, maybe it's tortilla or a piece of bread, or you wanted to have some cereal of some sort. Pasta is a good example. By using the carbo blocker, what it's able to do is basically reduce and lower the impact of these carbohydrates when you eat them, and so that your body is not having this high glycemic spiking, which then is creating what's known as the oxidative stress. That oxidative stress creates inflammation. And again, this is just the repetitive issues that we do to ourselves 3 to 5 times a day, pretty much minimally, right? At least in the United States. That we're making choices on foods, and we're not realizing, we're just throwing in calories thinking it'll all figure itself out. But what you're doing is you're giving your body either a low signal of inflammation or high signaling inflammation. And if you do it enough the wrong way, you basically just break down the body faster and faster. And, you don't enjoy your life. You're tired all the time. You're fatigued. You don't feel like exercising. You don't feel like doing anything. You start not looking good on the outside, and so on and so forth. So something like carbo blocker is a wonderful formulation for a lot of people, because this is a major area that stimulates trouble for people. The other formulation you brought up there was the lactose blocker. There are a lot of people, it's unbeknownst to them, they sort of figure it out by avoidance here and there, but lactose is, as you said, can be found in so many different products in our diet, and when it's getting in there, it can create a really dramatic response in people. Gas, bloating, pain, other forms of inflammation. And so lactose blocker is a very specific enzyme that's different than what we've seen in other formulations in the marketplace, in that it's a neutral pH lactase enzyme, meaning it works specifically in the small intestine where 80% of lactose is broken down, rather than all the other forms that are basically working in the stomach where you're only dealing with 20% of lactose digestion. And so this allows you to focus and really ameliorate the issues that lactose presents to a lot of individuals that trigger, again, more inflammation and more damage to not only the GI tract, but the systemic effect. So these are kind of good new
By the
ones.
way, when we was looking, it's not just elderly people. A lot of time when I started looking at this years ago, I assumed it was only elderly who had dysbiosis. Virtually maldigestion is kind of like a sentinel sign years before someone develops an autoimmune condition or diabetes or other problems. They're going to have hypochlorhydria. They're going to have dysbiosis. They're going to have abnormal gut bacteria. They're going to have small bowel overgrowth. I mean, these are just... And if you do testing, like, say, Genova Labs that uses gene marker probes and growth and cultures and all kinds of other things that are functional medicine tests at federally certified labs, this is not open to question. It just is. It's one of those is things. And the conventional doctors are not trained in this. They're not really doctors. They're pencil-pushing, prescription-writing machines. And that's not good. It's like insulting. Too bad. Wake up and take responsibility for your own training, doctor. Don't assume that the medical school or the residency training program, which, by the way, teaches you almost nothing other than spend some time in the library, was what they'll tell you, or respond to such and such a topic. The residency director will ask you to research and come back and make a talk on something. It means personal responsibility. So if you don't know, and again, this is what my grandfather, who was in the jewelry business, says. When he was criticized by one of his colleagues that was in the jewelry business 50 years, he says, "No, colleague X, you're in the jewelry business 1 year 50 times, not 50 years in the jewelry business." The same thing goes for medicine, professional training, nursing, whatever, which is why we got retired nurses and doctors, many of them coming to me looking for help, thank God, because they realized a lot of time their whole career life they were in a career pathway doing things that were toxic to their patients, and now ultimately they're screaming, "Oh my gosh, I don't want to do this to myself. I think this is bad." I'm glad they finally get it. I bet it's kind of late, because a lot of people got hurt. Same thing, we look at things like next enzyme, femgesterone. When we actually do saliva tests, which you can do at Genova Lab, Metametrics, through lab testing direct, you find the majority of women in their perimenopause are deficient in progesterone years before they're ever deficient in estrogen. And femgesterone, 2 or 3 pumps in the upper abdomen, lower chest will usually fix it. You can test with your saliva again in 30 to 60 days. And our hormone flash away, which we consider hormone synergy, will stop hot flashes. So let's talk about these for a minute, because a lot of women suffer, and also guys. And the reason why we call it hormone synergy is andropause or guy-pause happens, and guys think it's not a problem, and they're crazy.
Right.
It's a problem.
Well, there's plenty of commercials on TV and so forth, and urging guys that, hey, you may be suffering from low T and you've lost your vitality, and every guy out there that's over the age of 40 sort of goes, "Well, I think that is me. Maybe that is me." Well, first, what Dr. Bill's trying to get at is the environment in which we live in is so vastly different than at any other time in man's existence. And one of the big things is the bombardment of basically estrogens. And people, generally would say, especially guys, go, "Well, that's a woman's thing, right? That's not for me." Unfortunately, plastics, fuels, drugs, and pesticides are all loaded with what are known as xenoestrogen. And in order to protect our bodies and keep a balance, we need things like hormone synergy.
Along with things like xenoestrogen detox to get the estrogenic molecules out, the hormone synergy will actually stop the conversion of male to female. And female to male, by the way, for women, too. Back in a moment. Welcome back, and Ryan, that was a good discussion about the flash away and hormone synergy. Let's move on to vitamin K2. This is minoquinone 7, vitamin K2. We use it with our Power C Plus to detoxify, to alkalinize, and also to fight cancer. In fact, what I do when we have people with cancers, we give a full cancer protocol. I'm recommending 30 to 60 gram equivalents, which, remember now, every capsule of Power C Plus is 1.5 grams of vitamin C as a calcium, magnesium, sodium, potassium ascorbate with bioperin and black pepper extract, so it's 40% more absorbed. And then it's the only neutral pH ascorbic acid in the world, the only one. There's no competition, nada. And then we use with that minoquinone 7. Minoquinone 7 vitamin K2 is very powerful for not only bone regeneration, which is extremely essential for your fibroblasts, which require trace elements of manganese and molybdenum. And if they don't have these trace elements present, Silica boron is very also important, along with vitamin K2. Then you can't form bone, and you need type 1 collagen, which we get our collagen max and our tendon mender, which is going to support type 1 tenocyte activation, 42% of the dry weight of bone. So let's talk about vitamin K2. It has multiple uses: osteoporosis, neutralization of cancer cells. With high-dose vitamin C. It's very important for decalcification of calcified plaque. If you do a high-speed CT scan, you can actually get a calcium score of your arteries in 8 seconds if you do a CT. It's not that much x-rays, by the way. It's probably equivalent to maybe a couple x-rays, whereas the stupid tests like a Lexi scan is equivalent to 500 chest x-rays from just one Lexi cardiac scan. So I don't recommend a Lexi scan. I tell people do a treadmill stress test if you have to do anything. Do not do a Lexi scan because it's too dang much radiation. But a little bit of radiation, if you're really concerned that you have a high calcium score on CT scan, you can find specific areas and show that it's reversed. Dr. Deagle can prove it to you that vitamin K2 can reverse calcification of your arteries. Along with, of course, the right fatty acids like Omega Supreme Krill, Omega Cod Liver Liquid, which is head-to-head better than HMG-CoA reductase inhibitor, won't shrink your brain, cause your heart muscle to not contract, and cause your hormone levels to crash, male and female hormones. If you worry about low T, take an HMG-CoA reductase inhibitor, and you will have low T, because it's made from cholesterol. Interesting, eh?
Mm-hmm. Yes, very.
So the dumb doctors that wonder why you're no longer very virile, and they've given you an HMG-CoA reductase inhibitor because they always give all their XYZ patients those drugs, they are idiots. They don't know what they're doing. They're idiots.
It's just a shame. There's so much money and effort supposedly being used to do the right thing, and it's just, it's just heartbreaking when you realize that so much of it is driven by a certain profit motive versus.
Do you know how long ago the first study does in cholesterol? Dr. Chernoff at the University of Moscow in 1904. 1904. That's 110 years ago. 1918 to 1924, research at McGill University on trans fatty acids and polyunsaturated fats that are oxidized to make them solid, called margarine. And they proved in the whole line of pigs that caused all of them to get cardiac disease. We know only oxidized cholesterol and fatty acids gets under your artery walls and forms a nidus of a plaque called a dead macrophage or a foam cell. So any moron doctor out there that doesn't know what soluble ICAM 1 and 2 and the activation of the peripheral secondary oxidative pathways that cause formation of plaque, I'll give you the biochemistry, I'll show you the tests that you can do, and I'll tell you that you don't know what you're talking about if you're pushing these HMG-CoA reductase inhibitors. Now they say, it reduces inflammation. You want to reduce inflammation? Take nattokinase. It reduces things like plaque from atrial fibrillation. For God's sake, don't give Xarelto and these other garbage drugs. Give something natural. And then, by the way, the atrial fibrillation is simply caused by irritable atria because you get low oxidative metabolism. So CoQ10, D-ribose, IBS care, mitocarnitine, all these other things that restore that, to get rid of the heavy metals, raise magnesium levels adequately, and then use antiarrhythmics like our forskolin, but most importantly, magnesium, the regular calcium ion channel and gamma E+, for the gamma tocopherol. So your doctor doesn't know what he's doing, and they will just slam these drugs down your throat unless you slam back to him and say, no, I'm not going to do that. I'm not going to be compliant with that. I want you to know, why am I sick now? Do you know what my heavy metals are, free iron levels are? Do you know what my oxidative metabolism is in my heart muscle? Do you look at my organic acids to see, like the organics test at Genova Labs? Or the tests like at Dunwoody Labs, what they are? No, the doctor's not going to spend the time. You have to drag them by the lapels and say, test me. Tell me what this means. And if the doctors don't know, get taught. If they're really smart, they can talk to the lab director. They can talk to doctors who are using the tests. And they can find out, if they don't believe me, believe someone else. Please. So let's talk about this. We're now into gamma E+. Why is this so important? I mean,
if you take the wrong one, you're not helping your body. You could literally be hurting your body because you're blocking out such valuable components of what's known as, the full spectrum of tocopherols that are found in plants that contain vitamin E. And so it's buyer beware out there when it comes to the nutritional market. You see things that say vitamin E, you just assume that's what I need. That's what generally you heard you need. But the fact is, there's more to it than that. You have to understand what the plant components really are. And as you were highlighting, Dr. Bill, by not having a formula that is a broad spectrum that has high gamma tocopherol, which is really the most relevant and powerful of the tocopherols with regards to vitamin E, you actually set yourself up to a problem, blocking out all these beneficial effects. And there's been studies that have been done. You take high amounts of the synthetic tocopherol, and you may end up, in a worse situation, and you spent money to do it. How frustrating is that?
That is frustrating. By the way, I just got a consult the other day talking about something similar, is the idea of, we still have, by the way, GastroCleanse, which is a very powerful formula, but I tell people, with GastroCleanse, it is Saccharomyces boulardii. Only use one bottle. You do not use more than one bottle. GastroCleanse. It's a bowel cleansing formula. GastroHeal, I had a lady that contacted me the other day, and she had early pregnancy nausea, or morning sickness. And the first thing I tell her is, start chewing zinc carnosine, which is totally safe during pregnancy. It is not the purple pill or other things that are going to make you, hurt possibly the baby, because you don't know what the biochemistry effects are. And GastroHeal, 1 to 2 tablets chewed every 4 hours, will coat her stomach lining. I think a lot of women that are having morning sickness are actually having some form of abnormal peristalsis and bile gastritis, where they're actually getting reflux of bile in the lower stomach. And it'll coat the stomach and protect it from both bile and hyperacidity and from abnormal motility, which, by the way, you can also use our IBS care for that. So let's talk about GastroHeal for a second. This formula is, by the way, the most powerful natural formula, the most the most popular formula in Japan. Is the background research on this goes back to Japan.
Well, it should be the most popular formula to pretty much all the listeners out there if they're using, digestive support products. They're trying to deal with things like, gastritis, inflammation, and different symptoms that are occurring when they're eating foods that don't feel good. Again, that's, highly saturated airways with commercials for popping different pills that are supposed to alleviate your issues with eating certain foods and so forth. What's so neat about, GastroHeal is natural and highly effective and very safe with regards to its simplicity. It's zinc and carnosine in a specific combination that you just chew it. It works on contact. It basically has an effect from mouth to the esophagus to the stomach, where if there is a case of ulceration, very interesting studies done with it where it's known to basically help destroy H. pylori. It's studied with triple antibiotic therapy, which is, unique. But healing ulcers all on its own, very powerful. They've shown in 8 weeks' time somewhere around a 68% reduction in ulcerations, which is very powerful.
I'll give it with Allison Med, GastroHeal, and the Ageless. That combination is very good for healing the GI tract. Ageless, GastroHeal, and Allison Med. Back in a moment with Ryan and more of Nutrimed. If you have any question on any wellness issue, 800-259-5791. Nutraceuticals. And Ryan, I think you can explain it all, is glycemics. This is the first thing I put in my this morning when I made it up for myself and my daughter, because my daughter Kelsey, she's 21, she's been on nutraceutical and enzymatic support since she was the size of a peanut in my wife Michelle's tummy. And Kelsey, of course, is super healthy. She's had an admission to hospital, I think, like 12 years ago for 3 days because she got a mild infection with RSV. But other than that, she's never been on a cardiac drug. She's had 2 open heart surgeries, including a complete repair at the last surgery at the Denver Children's Hospital cardiac department. And she's not had any anticoagulants. She's not had any conduction problems. She's not had any shortness of breath. She goes on the treadmill an hour and a half to 2 hours a day. I mean, and so she's mixing up today, and I was putting in the glycemics, the life support, the Ageless Energize, the Omega Cod Liver Liquid, the D-Ribose, and ALC 1000, putting NutriComplete, which I have. And she loves mixing it, presses the power button, and gets all excited when she's making up her quote syrup, she calls it, her chocolate syrup. Ryan, glycemics is really important, not just for hypoglycemics, people trying to stay healthy, people trying to stay stress-free, because the glycemics kind of... I even had a recent lady who actually requested, was taken because she had some hypoglycemia, but she was using the glycemics to actually stress-proof herself from stress. And when she stopped her for a few weeks, she did a trial and just stopped and said, I wonder how I'm doing if I just use Ageless Life Support. Boy, did she find a difference. The Ageless Life Support are great. They're fantastic formulas. But you add stress proofing with glycemics, and your blood sugar and your adrenal hormones and everything starts to stabilize. It stress proofs you as well. Tell us all about glycemics. Right. Why is it such a great formula?
Well, it's the comprehensive aspects of it. First off, it's using what we would say is macro and micronutrients at the same time. So by macro, we're talking protein, carbs, and fats, like 21 grams of patented vegetarian protein, high amounts of fiber that are used basically to help ensure you get balanced glucose response. But then the nutrients that are in there, there's so many great ones, from ALA to the green tea to the patented cinnamon extract that's been shown so effective in research, to things like fat-soluble B1 that we know is really good at stopping glycation issues that damage tissues, to the inclusion of things like we talked about before, the ingredient of carbo blocker, the enzymes that help to reduce the carbohydrate impact that we eat every meal. So by using glycemic meal 1 or 2 times a day, you're completely transforming the way that the body is handling all the insults that are being thrown at it. And I know when I say insults, I know it's not like you guys are, people are out there just eating donuts and stuff all day long. It's literally small things. It can even be a pretty well, Atkins-related diet that still, if you don't have the right nutrients, your body responds and is still spiking glucose levels and still creating inflammation and damage like you don't want to see. And so if you're having issues of metabolic syndrome, the weight gain around the middle, blood pressure creeping up, cholesterol management is going off, triglycerides are creeping up. These are signs that you're moving into metabolic syndrome. You really need to focus on something like glycemic meal because of the comprehensive nature, macro and micronutrient support.
What I usually recommend is they replace 2 meals a day with like a full glass 8 ounces, and at least 2 snacks a day where they have at least 3 ounces as their snack. And now you might have something with it. But I tell people have only a low glycemic index. I like the George Cruz Carbo Block diet, but the best app is called Low GI, which you can go on your phone. And the George Cruz has got all kinds of great recipes. You can even use things like, flax flour and almond flour and coconut flour and other things. It's really important to understand that we have a lot of problems. For example, we have... I tell people, by and large, if you're going to have any kind of wheat bread, make sure it's sprouted, because it's going to have no phytates that are going to bind your minerals. If you want to make sure you don't have anything genetically modified in your food at all, including in the meat which you eat. Because a lot of people think, well, I'm not eating genetically modified. Yes, you are. You're eating beef that's been fed genetically modified food, or they're being fed grains, which are pro-inflammatory. And so people don't get this. And the next thing, of course, is Green Tea Select, which we renamed from Green Tea Supreme. Polyphenols are really important, and we have another formula called Nutri-Defense, which has the polyphenol, catech, and the anhydrous form. Each of these capsules will bind a lot of toxins in your body. It also speeds up your metabolic rate to burn off fat, along with things like LipoFlush and our other formulas like diabetoline, leptin, metabolic, and so on. So Green Tea Select is a detoxifier, a metabolic stimulant, and it's really important it's part of a lot of different formulas as the Green Tea Select component. So let's talk about that for a moment and explain why is it so good for your general health. What's in Green Tea Select? It's like 1 capsule equal to 10 pots of green tea.
Yeah, green tea is loaded with so many antioxidants and things that help with like thermogenic activity, like the fat burning effects that a lot of people are looking for. But this is a water-extracted green tea, very safe, very effective. And I say that because there's no mall practically in America that isn't saying, hey, use this green tea here. It's, lose weight with this one or that one. And people are going to be, dramatically disappointed with it because of the way that these things are processed. They typically have stripped out many of the beneficial components. And in some cases, they include things that aren't so good for you either due to the chemical extraction process. So that can be avoided when you're using something like Green Tea Select, and that formulation will be very protective of the body in helping to control free radical damage and inflammation. But as I said, adding it to an exercise regimen, a dietary program, is a really neat thing to do to help encourage the burning of fat in the body as well.
Another formula that's in a lot of things, and we've upgraded the source, which is, we've talked about before, but it's always good to revisit it because it's new, is the Immunomax, the NutriImmune, which is a capsule form. It's also in our Ageless. And, of course, we had to have labels say it's milk source, but it actually has a number of new components that actually stop milk and protein allergy, that boost your immune system more than the old serum-derived immunoglobulins. And if you look at people that are weak, their immune systems are weakened, then one of the best ways to measure that weakness is to do a immunoglobulin electrophoresis in their blood. And you find weakness in IgA and IgG antibodies especially. You see weaks, you say, hey, what happened to that peak? It's not there. Those people are more likely to get respiratory and gastrointestinal infections. And when you give immune imbalances like autoimmune disease, when you give Immunomax powder, Nutrimune, and Ageless, it helps repair parts of the immune system to protect against the gut infections, the respiratory infections, and the general immune deficiency that allows stealth pathogens to grow. Tell us about the new Immunomax, Nutrimune, and the Ageless with this new, colostrum-derived immunoglobulins, lactoferrin, colostrum, transfer factors, and so on, that are many components that were not present in the previous formula, which is excellent, but this is even one step better. It's a further enhancement of our formula.
Yeah, I think what you're talking about here is you're getting the closest you can to basically using something like mother's milk, and all the different attributes. So we talked for a long time about the bioactive immunoglobulins, which are really a critical component. You have to have significant amounts of these immunoglobulins put into the gut. Why? Because they're so good at our defenses of neutralizing bacterial, viral, environmental, as well as food allergen type challenges to regulate the immune system. That's really critically important. But there's other components that are found within these formulations that are in now Ageless, the Immunomax formula, the NutriDefense. And what you're getting now from things like PRP, the protein-rich polypeptides, when you're seeing the dynamic gangliosides, you're seeing sialylated acids, you're seeing components that weren't available in there previously, and all of a sudden they're much more powerful in their ability to kind of be a comprehensive support for the gut lining and regulation of the immune system. And this is so critical because most people are familiar with probiotics. They're familiar with just using basic amino acids like glutamine, but what they are not good at understanding is these aspects that are very unique, like you find here in the bioactive immunoglobulin formula, like you're going to find with Immunomax and NutriDefense and Ageless. These are critical. If you've been struggling a long time with gut challenges, this is something really important to bring in. And we've seen clinically relevant doses from what was previously in the Nutrimed line. We see it at basically you can use approximately 80% less on an ongoing basis for a therapeutic effect, which, well, that's great for everybody.
Yeah, it really is amazing. Now, the next, of course, is a quickie. Joint performance, tendon mender, and leptin metabolic. I mean, this is a triad. If you want to stop osteoarthritis, if you want to repair your joints, topically you can put around the joint curcumin cream. This is an amazing triple threat formula against arthritis, osteoarthritis, joint tendinitis, carpal tunnel syndrome. I guess we'll continue this discussion on Thursday, Ryan.
Sounds good, Dr. Bell. Thank you.
Back in hour number 3, John Moore will be back. Of course, his website is thelibertyman.com. His show with Ed Morrison from 6 to 7 a.m. Central Time, Monday to Friday on Republic Radio. And we're going to talk about prepper issues. We'll talk about any topic you want to talk about. Call in 800-259-5791. Our order lines are open. We have some amazing shows planned for you in the next few weeks and lots of new enhanced things available on Nutrimedical and clayandIron.com. We need your help to supply your needs and answer your questions. Again, hour 3 coming up in just a minute with John Moore. Stay tuned.